Welcome. I'm Dr. M, and this is drm.com, your channel, your home, your source, your resource for the treatment of incest and sexual traumas through the Eastern philosophical and medical methods in combination with contemporary psychotherapy methods to harmonize and synergize the best of the East and West as you seek to heal yourself, recovering from incest, development, abandonment, traumas, or as you seek to add to your skill set as a clinician in learning how to improve treatment outcomes by combining Eastern methodologies and philosophies with contemporary Western clinical therapies. So in this episode, we're going to talk about the treatment of eating disorders and digestive disorders. And I'm speaking of them under the same umbrella or in the same video because they are from a developmental trauma, particularly a sexual abuse trauma perspective, expressions of the same source. And that's where we all become more adept and more effective and more insightful and more knowing in our work with ourselves, if you're here doing this work for yourself, or with the people whom we serve, if you're here as a clinician seeking to learn more about treatment. So with abandonment trauma, with incest and sexual trauma, what takes place in an individual, what determines whether or not someone develops an eating disorder versus a shopping compulsion or a sexual addiction or a drug addiction depends in part upon the environment in which they developed, what was available to them, the other things that imprinted themselves on the psychology of the person in question. And this is where being an Eastern medicine practitioner can become very useful. The person's karma or the person's destiny or the person's energetic signature, their life narrative that they are here to live out. One of the reasons I became a Chinese medicine doctor is because Chinese medicine gave me a framework and a structure that was clear and clinical, which, by the way, makes it scientific because it's reproducible and the results, to a certain degree, are predictable. In addition to providing me with a framework and a language and a context for understanding how the mind works in the life narrative, very different from the Western psychotherapeutic approach. And for me, what I have found to be the case in my work, far more effective. So when we look at the life narrative of a person, how is it that someone has become someone with IBS, for example? IBS and IBD are, statistically speaking, now considered to be the primary digestive disorder for which a patient or a person presents to a Western medical clinician, a doctor or an MD, than any other digestive complaint on record. And what is being found through clinical trials and studies is that digestive disorders, in particular IBS and IBD, and the overwhelming majority of digestive disorders are rooted in childhood sexual trauma. You're welcome to Google link between childhood sexual trauma and IBS/IBD, NIH. NIH is the National Institutes of Health. They have some of the most credible clinical research available. So you can trust the articles that you find at the NIH website, and you'll see that there is evidence, there's clinical proof of the fact, it's my dog, there's evidence, clinical proof of the fact that there is a direct link between eating disorders, IBS, IBD, and childhood sexual trauma. Let's look at things from an Eastern medical perspective, because very likely you've come to this channel and you've come to my work because I provide you with the Eastern philosophical and deeper and perhaps more comprehensive framework for understanding the presentations that you see in your clients, in your patients, in yourself. Now, an eating disorder and IBS, IBD are expressions of the digestive system. They're also expressions of the immune system because 80% of the immune system resides in the gut. So when we have experienced something as a child, when we have experienced a sexual trauma, a trauma of any kind, but a sexual trauma in particular, that is beyond the mind of a child to process. And if the processing mechanism of the child in question is particularly vulnerable and susceptible to disruption and disturbance, not as hardy. You'll see this in picky kids who are picky eaters, sensitive system. Children in general, and this is a truism of Chinese medicine, children in general have what are called weak spleens. The spleen and the stomach are paired organ systems in Chinese medicine, and they are responsible for processing not just the physical food that we eat, but all of the experiences that we have in our developmental years throughout the course of our lives. And the spleen and stomach, but I'm going to talk about the spleen because it will keep the discussion a little more contained and easier for you to digest as you're listening to this presentation. The spleen has an associated emotion with it. In Chinese medicine, every organ has a physiological function, a season, a direction, a taste, a color, a part of the body to which it manifests or which it manifests, and an emotion. The emotion of the spleen is worry. The yin emotion of the spleen is worry. When the spleen is taxed, and the spleen is very susceptible to what is called taxation fatigue, overwork, overthinking. And imagine the life of a child. Imagine yourself at 2, 3, 4 years old, living in a home with a predator where you're constantly having to worry about when the next violation is going to take place. You're constantly monitoring yourself and figuring out how to manage yourself, how to protect yourself, how to hide yourself in such a way as to prevent you from being too unsafe. And there's no protecting a child from a predator in a home where the predation is either complicitly enabled by the other adults in the home, or it's completely unknown to the other adults in the home. So there is no protection. There is nowhere to hide. And you, as a child, I work with women in particular. So let's say you, as a small girl, 2 years old, 3 years old, 4 years old, picture yourself at that age and imagine what it must have been like, or must be like, to live with that level of fear, of course, and also worry and preoccupation. And if you happen to be a picky child, if you happen to have been incarnated, if you happen to have been born as someone with a sensitive stomach, someone with a very particular palate, someone who doesn't digest food as well or as easily, or you're just a picky eater, that's a sign of a very particular spleen. The propensity for you developing an eating disorder in the face of this predictably unpredictable sexual trauma is significantly higher than someone who was born with a propensity for lung-based deficiencies. Lung-based deficiencies, for example, asthma, eczema. Eczema is a lung disorder in Chinese medicine. Allergies. Now imagine, statistically, let's look at a statistic for a minute. Imagine that you, as a child, are growing up in an economically disadvantaged urban environment, which statistically has higher rates of asthma than children who grow up economically disadvantaged in rural areas. And you're a child who's grown up in an economically disadvantaged urban environment where the incidence of asthma is higher and you have a particularly sensitive stomach. What do you imagine the presentations that you might see would be IBS, IBD, asthma, eczema? And there's this sick child, what's wrong with my child? And layer on top of that the history of childhood sexual abuse How do you imagine the digestive system of such a child might not be functioning, having to process air that is unhealthy and unclean, an inability to extract nourishment from food through a picky digestive system, and the worry and distress and hypervigilance that comes along with having to monitor oneself chronically and having to monitor one's environment for attacks chronically. Childhood sexual trauma predisposes any of its victims to having disordered digestive systems, which can produce an eating disorder of any stripe. It doesn't matter what the eating disorder classification is, and or what previously was recognized as a medical condition, purely physiological medical condition of IBS or IBD. Even SIBO is something to consider. And I'll talk about SIBO in another video. But please stay on the channel, like, follow, subscribe to receive notifications on when more videos are produced. So looking at how to treat these disorders is the next part of this presentation. With sexual trauma, with IBS and IBD and eating disorders, wise as a clinician and wise for yourself to first start with mouth exercises. I have a whole video that will give you a battery of mouth exercises that you can use with yourself, with the people you treat if you're here as a clinician. But I'm going to teach one mouth exercise here that will help to restore, recalibrate the nervous system around any sexual trauma, around any eating disorder, around any IBS, IBD diagnosis. That because it's quite simple and quite straightforward. It's a sucking motion. Sucking is the first thing that we do, typically, statistically, after birth. First thing that babies do, the first things that any of us do usually, unless there's a latching disorder or an attachment disorder, is reach for our mother's breasts and the nipple to connect ourselves to life itself. So when a baby is able to latch on healthily and effectively after birth, there's a direct connection with the mother. What typically happens in childhood sexual traumas, especially when we see a presentation of eating disorders, digestive disorders, is that there either has been mouth trauma, so there's been some oral trauma related to the sexual trauma. I won't go into graphic detail in this presentation, but there's been an oral trauma or a mouth trauma. And by simply restoring the suckling mechanism, we speak to the earliest part of the digestive system, and we speak to the earliest part of the nervous system that developed the first physical activity that we do habitually after birth. So you bring the brain and the nervous system back to its most elementary state. So the sucking mouth exercise is simply curling your tongue into a cylinder. If you can do that, some people genetically are not able to do that. If you're one of the people who's not genetically able to curl your tongue into a cylinder, to do that, then I invite you to get a sugar-free lollipop or a sugar-free sucking candy. If it helps you to have something to actually suck on, you're certainly welcome to do that as well. But if you're at work, if you're in a meeting, if you're driving, if you're somewhere where it's not appropriate to have something in your mouth, you can do this sucking mouth exercise wherever you are. However, if you need some help and support, get some help and support. The sucking exercise is quite simple. It's as follows. Make a cylinder out of your tongue. And you can keep your tongue in your mouth. And you're just going to suck very gently, like a baby, newborn, just drinking its first drops of milk. And you imagine yourself also as an infant, as a neonate, freshly born, brand new on this side of the veil, coming into the world and receiving nourishment from your source of life, your mother. And you do the gentle sucking motion, perform the gentle sucking motion until you feel a change in your nervous system. You might feel better. It made me instantly feel better. I do these somatic exercises so often and so frequently now that I just have to think about them and my body starts to go, oh, we're about to feel better. So I invite you to do this anywhere you are, particularly if you have a propensity for anxiety, or if you feel an IBS, IBD attack coming on, or if you have an event coming up that you know is very likely to trigger an IBS or IBD attack. Just start doing your gentle sucking motion. Make a cylinder out of your tongue. I'm sticking my tongue out so you can see, but you can keep your mouth closed into this and just gently suck. If you're in a meeting and someone asks you what you're doing, just say, my acupuncturist told me that I needed to do this. I have a thing going on. My acupuncturist and I are working on it. And if you're watching this video, you can now consider yourself officially having an acupuncturist and just say, my acupuncturist told me to do this. So that's one of the ways that we start to work with developmental trauma, sexual traumas, eating disorders, IBS, and IBD is by working with mouth exercises. The next stage is to work with the neck. Now, I have a whole history of Feldenkrais exercises that you can do for the head and the neck, and you will find them on this channel. So I invite you to look into head and neck exercises because with incest trauma, while there may not have been direct oral trauma, there is invariably some head and neck trauma because of the stress and the strain of protecting oneself. The reptilian response, the base of the brain is the reptilian area of the brain. And the reptilian response will cause the posterior suboccipitals, the muscles at the base of the skull on the outside of the spine, to clamp down and to create a forward head, forward shoulder syndrome. That is a protective mechanism. That's the body's instinct for protecting the base of the brain, where the nerve centers that control the heart beating and the diaphragm continuing to function automatically are located. So when we experience a threat to our lives, and a sexual trauma, an incest trauma is absolutely a threat to one's life as a child, because it's a threat to one's existential life. While you may never have been threatened physically, while your physical life may never have been presented to you as something that was on the line if you do not comply, succumbing to the sexual abuse, succumbing to the trauma, complying, and going along with the abuse to save yourself from something perhaps being worse is akin psychologically to one's life being in danger, to the threat of losing one's self, one's existence. And this is where the Eastern philosophies become very useful and indispensable, I have found in the work that I do. The fear of death is it's the thing that unites all of us. It's the fear that unites all of us. The loss of the sense of self. And having to sacrifice and surrender one's agency as a child and allow oneself to be taken over, violated, dominated, co-opted, commodified, used for someone else's unpredictable pleasure requires on some level that you dissociate from your essential self. That level of profound psychological and metaphysical dissociation is experienced as a form of energetic death. It's the loss of self. It's the loss of the child and the girl and the adult and the grown woman that you will never have a chance to be because that part of you got corrupted so early on in life. That kind of difficulty and inability to support oneself and advocate for yourself as a child becomes lost. And with that, the sense of self and the sense of death becomes active in the autonomic nervous system. The posterior suboccipitals clamp down, and we have chronic neck and shoulder tightness. When working with eating disorders, you may also see the presence of bulimia, binge eating disorder, compulsive eating disorder. There may also be anorexia. That's the whole thing about eating disorders, why I said in the beginning, the classification of the eating disorder doesn't matter. The presentation that's in front of you in combination with the life narrative that your patient shares with you, or the life narrative that you're able to discern for yourself from studying your history and your behaviors, is all the information that you need. Just working with the individual in front of you, working with the person that you are, and your life story and your life narrative is all that's needed to begin to turn the tide on something that's been in place in your life for decades. If you're a woman over 40, a woman over 50, I work primarily with women over 50. These things have been in place for decades, so it's a slow process. So developing an understanding of yourself as a clinician, if you're here as a clinician, it's a slow process of developing a relationship with the person with whom you're working so that trust is established. And that is the final piece that I will put into this video. There are many, many, many somatic exercises that are available for you to treat eating disorders and IBS and IBD related to childhood sexual trauma. Too many, in fact, to mention. But I wanted to present these ideas and this approach to you to give you a solid foundation for understanding how to work with yourself and how to work with the people with whom you are working. Now, lastly, with IBS, IBD, eating disorders, anything that you're treating that has a history of childhood sexual trauma, incest, sexual abuse, or any developmental trauma for that matter, something that I just mentioned, and it's trust. Establishing trust within the person in question is the primary objective in treating eating disorders, IBS, IBD, quite frankly, anything. It's the loss of the sense of trust. I was just talking about fear of death and how the loss of connection with oneself, the loss of the self that will never have a chance to be as a result of the interruption and the disruption of the sexual assault creates along with it a loss of trust of self, shame, self-blame. I speak with so many women who remain mired in guilt and shame, questioning how it is that they allowed the abuse to happen and feeling more shame for the physical responses of their bodies that they were unable to control. Well, I liked it and it felt good, so it must be my fault. That kind of relationship with self, that kind of damage, that kind of corruption of the relationship with oneself is a direct indication of the loss of trust. And once someone has lost trust in themselves, this is how we develop trust issues, the rest of creation and the rest of humanity. If you're sitting here watching this and saying, oh my gosh, yeah, I have trust issues, look to your own developmental narrative. If you're working with someone who has trust issues, the best thing you can do as a clinician is to continue to do your own work so that you are able to remain a clear channel of honesty and spaciousness and non-judgmentalism, acceptance, and neutrality, so that nothing they say will overwhelm you or shock you. Again, this is where the Eastern methodologies come into play. It's recognizing that this too, the trauma too, the IBS, the IBD, the pain, the difficulty with living a healthy social life, a healthy professional life because of a medical diagnosis, and incest, trauma, and eating disorder, the shame and blame, the hiding, the impact on your finances, the impact on a woman's teeth, the impact on your body that comes from something that's rooted in a victimization of a childhood self. When none of these things shock you anymore and you're able to maintain a neutrality that understands that this too is part of the human condition, then you can be the clinician and the person with whom your patient, your client can feel safe. When the inner children selves come to understand, when the earliest versions of ourselves that are encoded into the brain and imprinted in the mind begin to see on a consistent basis that nothing is going to happen to them that they cannot handle, that you, with yourself, if you're here for yourself, or you as the clinician, if you're here as a clinician, have the capacity for just being in the room with it. Those earlier parts of self that are encoded with the shame and blame have the willingness and the courage to start to let go of the protection of the fragile self that the eating disorder is seeking to protect. Eating disorders, IBS, IBD, SIBO, the whole panoply of digestive disorders, menstrual irregularity, migraines, it really doesn't matter what the diagnosis is. It's all information for a disruption, a disturbance in the force, I like to call it sometimes, but a disruption in the relationship of the person with themselves. It's the loss of trust in the self that you can establish in your relationship with them if you're the clinician, and that you can learn to establish with yourself as you continue to do this. So thank you very much for taking the time to hopefully enrich your existence and the existence of the person with whom you're working. And Dr. M, like, follow, subscribe for more information and more videos. I'm here to be of service to you, your incarnation, and the awakening of your consciousness as you seek to restore yourself to complete wholeness and fulfillment, and to do what Chinese medicine refers to as manifesting your own destiny. Thank you so much. I hope you'll come back.